Riesci a questo?
Io qui eravamo contenti, io vorrei raggiungere.
Ilahi aksikema tem fuitede. Yanga bari premium. Mosha kuka space so that.
O vale kupukula ko
give an address, and he did reveal that there were 14 new positive tests of COVID-19, and 683 tests were conducted. So we will hear more about what will happen today. We did hear that 2 health workers, one from Lusaka and one from Kabwe, were in those 14 positives, as well as 6 truck drivers. Also, a lorry assistant from Tanzania was also reported as a positive case. There are many more around that issue, and like you say, many people are digesting the presidential speech, and I've seen the various stakeholders in studio just giving their opinions to the speech and just analyzing how the next few days will go. But for now, the most important thing is what has taken place in the last 24 hours, and Dr. Chilubya, the Minister of Health, addresses the nation.
Good morning, countrymen and women and members of the press, and welcome to today's press briefing. Yesterday, the Republican President, His Excellency Dr. Edgar Chagwa Lungu, addressed the nation, reminding all of us that we were still actively battling COVID-19 pandemic. The President directed cautious reopening of key areas of the economy and key areas of various activities that we do in our livelihoods, but emphasized the need for adherence to public health regulations, rules, guidelines, and certification. The President has been consistent, and I'd like to reiterate his call for all of us to ensure that we are conscious that the COVID-19 outbreak is still with us, and as we reset to a new normal, and as we cautiously reopen specific areas of our activities, it is important to subject this to the lens of public health rules, guidelines, and regulations. So, therefore, it is important to note that the key areas, the key guidelines remain the same, that we restrict public gatherings and enhance public, personal and environmental hygiene, and let us ensure that we wear masks in public. And he urged the clarion call to all of us to continue being alert and notify suspected cases. And as we gradually return to normalcy, ensure we practice physical distancing. I urge all of us to be adherent to the guidelines and to the directives as given by His Excellency President Edgar Chagwa Lungu, and ensure that in all we do, as we cautiously return to normalcy, we respect public health guidelines. Health authorized officers are on hand in every part of the country to support you as you gradually return to normalcy. Remember, the screaming theme is that the President would like to see that delicate balance between averting a public health crisis and avoiding people being hungry and becoming poverty-stricken. So that delicate balance to avert a health catastrophe and allowing the economy to run summons all of us to the responsibility. One, yes, to return gradually to normalcy, subject to observing public health regulations, guidelines, and certification. This, the President has been very consistent about. Countrymen and women, the President further said that COVID-19 will be with us for some time, and therefore it was important that we adapt. And in adapting and ensuring that the key areas of our livelihoods are quickly resuscitated, it will be important to ensure that we move in tandem, returning gradually to where we were, but observing public health rules so that the public is not at risk of a public health crisis. This is the consistent message from the President. Trade and commerce needs to continue, while ensuring that the environment in which trade and commerce is happening is devoid of the risk of escalated COVID-19. Therefore, let us hold hands and in solidarity work together and ensure that we follow stringently the guidelines as pronounced by His Excellency President Gachagua in yesterday's address, and we are on ground. We are on ground to continue supporting you as you follow the guidance and directives that His Excellency President Lungu gave yesterday. Today, as we update the nation on COVID-19, I will be focusing on two key areas. One, the mass screening and targeted testing in Nakonde that we've been talking about. Two, I will be talking about the rest of the country in terms of the targeted testing and the mass screening that has been taking place in certain communities and in our health facilities as part of facility surveillance. Let me begin by giving the preamble to the Nakonde situation. The Nakonde situation was brought to the fore when we had two cases, a couple that traveled, one to Nakonde, one to Dar es Salaam, and they tested positive after they presented with some symptoms while in quarantine in Chingola. The Zambia National Public Health Institute, working with the provincial team, immediately swung into action to do contact tracing, aggressive contact tracing. And beyond that contact tracing, the team also decided to do mass screening and targeted testing of the various stakeholders in Nakonde to ensure or to reinforce their decision to do that intervention in Nakonde. We did notice a spike in the number of truck drivers that were coming from across the border in Nakonde on the Tanzanian side, the increase in numbers of truck drivers that were testing positive. So we did, therefore, intensify the mass screening and targeted testing in Nakonde, and today we will report on those results. Before I zero in on Nakonde, I'd like to inform the nation that we have recorded 3 deaths that are COVID-related. Now, the 3 deaths that are COVID-related that we have recorded involve an 82-year-old patient from Nampundwe who had a cerebrovascular accident, or commonly known as a stroke, at home and was rushed to the Levi Mwanawasa Teaching Hospital. And on arrival at the University Teaching Hospital there, the patient in the unconscious state was examined and resuscitation began. Part of the investigations involved doing a CT scan that was done at the University Teaching Hospital. The patient was subjected to the routine protocol of screening for COVID-19, and this patient did test positive for COVID-19. And this patient succumbed to the complications of the cerebrovascular accident and was also found to be COVID-19 and has been notified not only as a COVID case, but also as a COVID-19 related death. Remember that the probable causes in cases of this nature are very clear. The CVA itself, massive as it was adequate to cause the mortality. But other findings did include also COVID-19. It's also important to note that vulnerability to severe is also enhanced in patients where you have COVID-19, as studies have revealed. But it's important to note that this patient had a massive bleed secondary to hypertension, and this patient was elderly, was 82 years old, and came into the hospital critically ill with the complications of cerebrovascular accident, or commonly known as a stroke. The second patient is a 30-year-old female from Ngombe compound in Lusaka, and this patient has been in our care for a chronic liver condition called cirrhosis. And this patient already had developed hepatic encephalopathy, or mental disorder associated with the condition that is in the liver there, simply put. But this patient had hepatic encephalopathy associated with a chronic liver condition known as cirrhosis. This patient was brought into the hospital critically ill, and as part of the protocols, we did swab, and we did find that this patient had also COVID, and we entered this patient as having died, yes, from the chronic conditions, chronic consequences, the consequences or the chronic complications of the chronic liver condition, but also noted the presence of COVID, so it is COVID-related mortality. The third patient is from Ndola, and this third patient did present to our facilities, again in a very ill state and was being investigated for tuberculosis. This patient was under investigation for tuberculosis and did present to the hospital, and as part of the investigations was swabbed for COVID-19, and this patient died a few days after admission to Ndola Central Hospital. These are the 3 deaths that are COVID-related that we have recorded in the last 24 hours. Further, I'd like to report that in Lusaka, out of the mass screening and testing and the surveillance that we're doing in our facilities, we have recorded 9 new cases. Those 9 new cases include the 2 deaths. So we mean that what that means is that Lusaka now has 7 new active cases that we are dealing with. And this is out of the 346 tests that we did in the last 24 hours. Getting back to our situation in Nakonde, where we were alerted of a challenge by the presence of those 2 cases, and also the increase in the recent past of truck drivers who were testing positive. I must report, and I must make this very clear, that when we got those 2 cases of a woman and the husband who tested positive, the team swung into action immediately and did contact tracing and tested all the possible contacts within Nakonde there, including the lodge and the staff they dealt with at the ports of entry, and the results of that investigation were announced and they were negative. But as you know, that the incubation period for COVID-19 is 2 to 14 days, and the situation on the ground can change rapidly. It can flare up in a flick of moments. It can flare up. So the 2 cases that we initially reported attracted an aggressive contact tracing process, and that yielded what we reported. But with more truck drivers, like in the last week where we reported 10 truck drivers that were positive, that resulted in a mass screening that involved 1, truck drivers, 2, immigration staff and agents, 3, members of the community, particularly in lodges where we know the truck drivers spend time, and our hospital staff that are part of the port health services. Out of these investigations, we now have analyzed 170 tests, and out of these, 76 have come out positive. 76 tests have come out positive, and these are broken down as follows. 26 are truck drivers that have been crossing into the country, and 13 are workers and commercial sex workers, workers from lodges and commercial sex workers, 13. And 31 involve our immigration staff and agents, and 4 are non-contacts of the cases that we had picked earlier. Therefore, the 76 cases that we pick out of Nakonde, added to the 9 cases that we picked out of Lusaka and the Copper Belt, bring the new cases we are notifying today to 85. So 85 new cases. The operation in Nakonde continues, and today we are analyzing another 650 tests. Now, the operation in Nakonde today brings out one key thing. Nakonde is the new epicenter for COVID-19. Number 2, Nakonde is an infected area that must be avoided. Number 3, in a whole government approach, we will institute stringent border control measures to avoid further importation of COVID-19, and also to ensure that we stem the community spread that is raging in Nakonde. We will therefore be getting back with even more details on the measures which will be informed by a whole government approach. The collaboration between Ministry of Home Affairs, Transport and Commerce and Industry, and the Ministry of Health, and indeed any other stakeholders will inform measures that we will be announcing pretty soon. The screening continues. The cases that you see out there, the truck drivers population, if you notice, is a lot. We allow truck drivers to come into the country carrying petroleum products, carrying essential goods, which is important for us, especially with our land-linked status, to ensure that we allow essential services, essential commodities, fuel and food to get into the country. We will ensure that we tighten our border controls using the collaborative actions, anchoring on the collaborative actions of various departments of government. We want to reiterate the call by His Excellency President Edgar Chagwa that as we cautiously and gradually return to normalcy, we should adhere to public health measures, and that all the actions that are announced are subject to review based on the evolution of the pandemic and based on the responsibility that we see from your end as the community. We want to thank all of you who have been adherent and compliant to the regulations that have been clearly set out in the Public Health Act, in statutory provisions SI 21 and 22, and in the presidential directives that His Excellency President Lungu has consistently given to the nation. We will shift. We will be admitting all our patients in one facility in Nakonde and in another facility at Chinsali General Hospital. We've reinforced staff at the facilities, and we are going to ensure that all that are picked out as positive are managed in our isolation facilities. For those who are returning from Nakonde, for those who are returning through the Nakonde border, you will be mandatorily quarantined and won't be allowed to proceed for a minimum of 14 days and will be subjected to the testing, to the screening and the testing. So there is reinforced quarantine interventions in Nakonde. We'll continue advising you, we'll continue giving you the advisory not to travel to infected areas, and we'll continue advising you to postpone unnecessary travel. Advisories on travel will continue to be issued, and we also want to guide you, should you be found to be coming from a COVID high-risk jurisdiction through the Nakonde border, you will be quarantined mandatorily for 14 days at your own cost. And secondly, we also want to emphasize that for those of you who will be getting into a COVID high-risk jurisdiction, you will not only be subjected to screening, but on your return, you will be quarantined mandatorily for 14 days. We'll continue identifying designated truck parks for trucks that are carrying essential commodities and ensure that there is escorted movement of such trucks, whether to certain destinations in Zambia or in transit to other parts of the country, assuming that these trucks are carrying essential goods such as petroleum, mining requisites, food, or agricultural inputs. We will continue to facilitate trade and commerce while ensuring that we limit the importation of COVID-19. The number that you received today is a reflection of the sensitivity of the surveillance activities that the MOH sectoral team has embarked on. It is also going to inform further action. Nakonde remains to be, or has emerged to be, the epicenter of the COVID-19 in Zambia and is an infected area. Cross-border collaboration with our counterparts in Nakonde, in Tanzania will continue, in Congo will continue to ensure that we limit the spread of COVID-19 in our jurisdiction and in other jurisdictions. We will continue engaging with the community through various platforms and ensure that we sensitize you with information that will protect you from COVID-19. Remember, the President emphasized that the battle against COVID-19 continues, and there are models that project that we haven't yet peaked, and there are models that show that the worst is yet to come, and it is important that we adhere to the public health rules even as we gradually return to normalcy, and that this gradual return shall be passed through the public health lens, shall be passed through the analysis of data or the pandemic as it evolves. Therefore, you'll be regularly updated as guided by His Excellency President Lungu to ensure that we are able to balance, establish a delicate balance between avoiding a public health crisis and ensuring that the wheels of the economy do not grind to a halt. We continue appreciating the community for alerting us, and we have received 3,647 alerts from the 1,821 alerts from the community, and these have been cleared as non-cases. We also want to thank those who have adhered to the 14-day quarantine period, and today 3,647 cases have been discharged from the 14-day quarantine period. A peep into the global picture, we have crossed 4 million, and we report 4,014,500 cases of COVID-19 cumulatively, with deaths now hitting 276,253. We, however, report on a positive note 1,387,259 recoveries in 212 countries and 2 conveyances. Back home in Africa, we have recorded 59,124 cases with 2,164 deaths. 19,839 recoveries have been recorded. Zambia, being the anchor of the Africa Center for Disease Control, and through our Foreign Affairs Ministry, will continue engaging in cross-border interactions to ensure that we work together collaboratively with our neighboring countries. One, to ensure that movement of essential goods is not inhibited, but at the same time limit the possibility of importing COVID-19. For us back home, let us continue to ensure that the measures that have been announced are strictly adhered to. When we look at Nakonde, isolation facilities that have been established and that will continue to be established will either be in Nakonde or Chisali. Our 2 treatment facilities will be Nakonde and Chisali. We have dispatched staff, medical supplies, and other consumables to support the effective management of cases in Muchinga. Surveillance too has been enhanced, while port health services have also been enhanced. Distinguished ladies and gentlemen, when you analyze the number of cases that were tested together cumulatively in the last 24 hours, what you will see is that, like analyzed earlier, the total, when you look at TDRC testing center and the UTH testing center, is a total of 85 cases. It is also important to note that we have discharged further 1 more case, and this brings the total number of recoveries in the country to 112. Let us mask up, let us avoid public health gatherings that are not adherent to Public Health Act, and let us continue practicing personal hygiene, and let us ensure that we do not engage in unnecessary travel, especially to COVID high-risk countries. I thank you for listening today, and that's the update for the day.
There we are. That was the address by the Honorable Minister of Health, Dr. Shtabu Sofia, on the COVID situation in the country today, the 9th of May 2020. We will now proceed to allow members of the press to seek clarification on the briefing
ensure that these virus don't diseases transmitted?
Well, thank you very much. The president was categorical that specific areas of the economy will be reopened cautiously and subject to adherence to the Public Health Act, or subject to the Public Health Act and Statutory Instrument 21 and 22. And so, all the specific areas that were itemized are not just reopened without a caveat. It is with a caveat. It is with a proviso. You must ensure you adhere to the Public Health Act. That's exactly what the president said. He is cautiously reopening specific areas and admonished all of us and those involved to ensure that as they do so, they adhere to the provisions, the guidelines, and be certified through public health authorities. And I said that our authorized officers are on ground to support you to execute as guided or as directed by His Excellency President Edgar Chagwa Lungu. The statement again on schools was very clear, and it's important that we quote His Excellency the President correctly. The President did announce a date for the reopening of schools, for the reopening of examination classes, and made it very clear that universities, colleges, and indeed anybody else involved in education need to collaboratively engage to determine when they would reopen. And both situations, he made it very clear, subject, one, to his watchful eye of the pandemic, and two, to the Public Health Act and the statutory provisions therein. So it needs no further explanation that consistently the President has said we shall gradually return to normalcy in the face of COVID-19, but we will strike that balance between ensuring we do so and averting a public health crisis, and that he was carefully watching the pandemic, and that data that is adduced on a daily basis, information adduced on a daily basis, the evolution of the pandemic would inform further strategic policy direction. And I think that he was very categorical about. And therefore, my simple response to that is that the President is consistent and made it very clear that subject to public health rules, guidelines, certifications, there is a cautious easing of certain specific areas of our livelihoods, and that he was carefully watching the pandemic and would use that to strategically provide guidance. It is the reason he's regularly addressing the nation on the subject.
Honorable Minister, there was a question on the Zambians living abroad.
Well, the data we have so far is that we have lost 4 Zambians that living abroad due to COVID-19 in America and in England. And this will be subject to confirmation. I mean, this will be subject to updating should there be any more information that we get through our Ministry of Foreign Affairs. But to date, that is the information that we have, and we will update the nation should there be more information that would have come in through our Foreign Affairs Ministry. There are many Zambians out there who did suffer from COVID-19 and who have recovered from COVID-19.
Well, thank you very much, Honorable Minister. We'll give another opportunity for questions if we still have any outstanding questions.
Good afternoon, Minister. The first question is, Then also to ask whether we will see screening in towns like Kitwe, where we do see buses from Nakonde or trucks coming in on a daily basis. We'd also like to find out what is being done about the arrivals of Zambians from India and how you will ensure that quarantine is observed.
Well, thank you very much. Since that was a mouthful, Kangwa, I'll go ahead and respond and wait for the other questions. First of all, the capacity in Muchinga is adequate to manage the cases we've reported so far. Like I alluded to earlier on in my updates, we were battle ready and did isolate or did pick out Chesali General Hospital with a capacity of 300 as a quarantine facility or isolation facility for treating cases of COVID-19. We already have appropriate transport from Nakonde to Chesali to move patients. Secondly, within Nakonde itself, we have a facility that is 60 bed, that is looking at management, that is going to assist us in management of cases further. We are in engagement with our stakeholders, our colleagues in a whole government approach to transform some of the infrastructure there into isolation facilities or quarantine facilities for those who are returning home to augment to what is existing there. If you are speaking about passenger transport, I did make a statement that we will be reviewing our border restrictive measures. And we want to emphasize that in a whole government approach, we will come up with measures that we will announce shortly on the stringent border control measures that will help us limit the possible spread of COVID-19. Our capacity to test is increasing on a daily basis. Remember that we have said before, the gene expert machine, which traditionally has been used for diagnosis of tuberculosis, is now being reconfigured using specific cartridges to ensure that we can do testing for COVID-19. And Muchinga is one province with adequate gene expert machinery, and so our capacity, laboratory testing capacity, will be enhanced in Muchinga. Further, this is not only applicable to Muchinga, it is applicable to all the border points in the country. Remember, we've been saying that we'll do prevalence studies, and therefore, even in places where we don't have pointers, there shall be sampling of specific areas as part of the prevalence study to ensure that we understand fully the extent of the challenge in the country. And we also use it as an opportunity to confirm that the quiescence we hear in terms of data resonates with what we believe, that there's no COVID in those areas. So that is going to be done. But we will maintain our advisories. Why would you travel to an infected area? We will quarantine you if you're coming back from an infected area at your own cost. And failure to adhere to quarantine rules will attract severe punishment, including prosecution and jail sentences. And we'll not jail you in a place where you're going to transmit COVID-19. We'll find somewhere to keep you.
Honorable Minister, you may wish to comment on the arrival of Zambians from India.
Yes, we did announce the other day that we were expecting a total of 600 Zambians who were returning home from India and South Africa. These are either returning students, or people who were undergoing therapy in those specific jurisdictions, or people who were coming back from their routine visits. And we have adequately prepared for them in terms of quarantine and in terms of testing. And so far, we have received a number. The other day, we were reporting 31 that had come in from India, and we thought on day one we'd actually be dealing with about 60. So we'll continue updating the nation on the return of citizens from foreign jurisdictions, but they will be subjected to quarantine rules, mandatory quarantine. And this is to ensure that we limit the spread or the importation of COVID-19.
Well, thank you very much, Honorable Minister. And I see no further desires. Is that a hand? Okay. We could have that as our last question.
Honorable Minister, I have two questions. One Honorable Level from Spring TV again. With schools open in other areas that are not in Akonde, how will social distancing be enforced, especially that in some government schools we have PQs that are at least about 60%, above 60 PQs in a classroom. And then I also, have we been able to acquire enough test kits to be able to test PQs as they come in and they leave schools? Thank you.
Minister, Magoro Winston is the name from Diamond Television.
You're back. You wanted me to resign, and you're back to ask me questions.
No, I come in peace. I come in peace, Honorable Minister. Yeah, so mine is just a follow-up on what you mentioned on enhancing robust COVID-19 preventing activities in border towns. I just wanted to find out, does that include mass testing as well, looking at the numbers that Makonde is reflecting at the moment? And secondly, it's a follow-up on the Eastern Province case where the woman was tested, traveled for a funeral, and before, as she was coming back, she was communicated to that she is COVID-19 positive. I'd like to find out, how did she travel after being tested? Are you privy to the details of that particular case? Thank you.
Any other questions, members of the press, or you forever hold your peace? Any further questions? None. Thank you very much. The woman that traveled to Eastern Province was tested, and the result was negative. She was tested and she traveled, and the result was negative. So we don't have any new case in Eastern Province. And this is the same message that Eastern Province administration is telling the whole world. Should there be any information from any province, we will liaise and ensure that we communicate appropriately. Our capacity to test in our various provinces has improved with the introduction of the gene expert machines as part of COVID-19 Almari, and therefore Muchinga, Eastern Province have all enhanced laboratory testing capacity. My answer to the question on from our lady from ABN, is it on school children in Muchinga? School children that are in other parts of the country? Yes, other than Akonde? Yes. Well, first of all, I want to emphasize that the surveillance activities that are taking place in Akonde are the same surveillance activities that are taking place in other border areas. So when we pick up cases, they give us a lead. We also are alert to what's happening across borders, and that gives us also leads. So as we speak today, even if you hear that certain borders are not reporting cases, it's not because there's not testing taking place, no. There is active surveillance, active screening, the index of suspicion is high, active case finding is going on, and it's only because we're reporting them as either not meeting the criteria or case definition for a COVID-19 case, or they're testing negative. And some of the tests that you hear are being produced from the mass screening using our UGH virology laboratory or TDRC laboratory are actually tests that are coming from certain borders as part of the routine surveillance, 7 border areas as part of the routine surveillance. Like I said, the president was categorical. A phased approach, a gradual return to normalcy, the president was categorical. All that he eased in any specific area shall be subjected to public health rules, guidelines, regulation, and certification. Further, he did betray his watchful eye on the pandemic, analyzing the data as it evolves, engaging with his technical machinery, and ensuring that every decision he makes, it will be informed by the current data. So, in analysis, continuous analysis of information related to COVID-19, the president shall be guiding the nation on strategic policy direction. And what he gave yesterday, I would reiterate, was to put on the wall loudly that delicate balance between ensuring or minimizing the disruptive effect of COVID-19 on the economy, and also that we don't have a huge catastrophe in the health sector that affects the people. So that is the consistent message from His Excellency President Lungu.
Thank you very much, Honorable Minister. A clarification, please quickly just do that before we proceed to the next part of the program.
Honorable Minister, just a clarification. Just a clarification, Honorable Minister, on the same Eastern Province case. There were about 107 samples subject to correction or verification from the office that were sent to Lusaka from Eastern Province. Were all those tested and did they all come out negative? That's what I wanted clarification on.
Well, maybe you're referring to a woman who traveled to Eastern Province, for a funeral, and was tested when, before they traveled, and as they were reaching Chongwe, they were picked out. The results had already come out, and the result was positive, and they were quarantined in Chongwe, and that was not an Eastern Province case. In case that's where the confusion is coming from. This was a Lusaka best fellow person who intended to travel for that funeral, and they got the results in Chongwe, and they was quarantined in Chongwe. So it's not an Eastern Province case. And that's been reported as part of the statistics. So, well, here we are. 85 new cases in the country, 1 discharge, bringing our total discharges to 112. With the 85 new cases, therefore, we are at 252 cumulatively cases in the country. We have 7 COVID-related deaths, and all the patients that are with us remain stable. The deaths that we are reporting, we should remember that yes, those with comorbidities will succumb earlier or easier to COVID-19. So COVID-19, you carry a higher risk with advanced age, with comorbidities such as hypertension, cardiovascular conditions, other cardiovascular conditions, TB, chronic immunological problems, or in fact, deficits in our deficiencies in our immunity, and many other chronic disorders. Comorbidities generally will predispose you to succumbing to COVID-19. And therefore, stay home, wash your hands, make sure that the environmental hygiene is enhanced, and even as you gradually return to normalcy in specific areas as announced by His Excellency President Edgar Chagwa Lungu, respect what has been dictated in the Public Health Act and the Statute of Provision 21 and 22, and we are on ground to work with you. Surveillance countrywide will continue, and strict border control measures will be announced, and other measures for Nakonde while the screening and testing takes place. I've said repeatedly, we are in the stage phase, and we expect to see more numbers with our enhanced testing capacity. His Excellency President Lungu summed it up well by saying we will still have COVID in our country, and as we live with COVID, let us ensure that delicate balance between allowing our economy to run and also avoiding a public health crisis. So we thank you very much for listening.
Honorable Minister, the Cabinet Secretaries, we continue to receive a lot of goodwill from various partners across the country who have given a boost to this fight against COVID-19. This morning, I'm privileged to announce that the Pharmaceutical Society of Zambia wishes to make a donation, and I'm honored to call upon Mr. Maui Banda, the interim president and delegation leader, to come and give some remarks and present this donation.
The Pharmaceutical Society of Zambia.
Yes, Honorable Minister.
Right.
Society of Zambia.
And you are the interim president. What has happened to the substantive president?
We are telling you new day.
Well, when he was shooting government, it was big news. When he was thrown out, it's not news, and we're hearing through this announcement. Well, welcome to the new slot.
Thank you, Honorable Minister. All protocols observed. I am here privileged by pharmacists and pharmacy personnel in the Pharmaceutical Society, as well as the interim leadership of the Pharmaceutical Society of Zambia, to present a donation to the fight against the COVID-19 pandemic. As you know, the Pharmaceutical Society is a collection of pharmacy personnel motivated to take our place alongside other health professionals to contribute to the quality healthcare delivery that the Ministry of Health leads. The in-kind donation that we are making, Honorable Minister, is valued to total of 146,000 kwacha. And it's composed of various items that are useful for the prevention of transmission of COVID-19. We will be able to view those items, Honorable Minister, when we walk out of here. But it is hand sanitizers, face masks of various descriptions, surgical and examination gloves, washing detergent, and sterilizers. We are also donating, Honorable Minister, a unit for air conditioning that we are designated to be installed at the pharmacy that is serving the COVID center at Lady Manawasa. I don't want to make a long speech, Honorable Minister, but we make this donation with two simple messages. The first is that the Pharmaceutical Society of Zambia stands with other health professionals at the heart of the front line of the fight against COVID-19 in this country. The second, Honorable Minister, is that the Pharmaceutical Society of Zambia stands with you in the fight for the health of the people of Zambia in this current fight of COVID-19, as well as in your pursuit of the Ministry of Health legacy goals for health.
Thank you very much indeed.
Thank you very much, Pharmaceutical Society of Zambia, and we continue to call upon all stakeholders to join in this fight. Honorable Minister, it's now my honor and privilege to call upon you to give your concluding remarks.
The Pharmaceutical Society of Zambia is an embodiment of highly sophisticated scientists in the medical profession. key stakeholders in the provision of health services to the people of this country. Health services across the whole continent, of care. They are involved in promotive medicine, preventive medicine, curative medicine, rehabilitative and palliative medicine, and they are a consistent feature on all those pillars. They are principal stakeholders of government in the provision or improvement of health services. As we talk about case management, they are the ones who even substitute drugs in alignment with the science and ensure that there is adequate treatment of our patients. They work with everyone and lead in ensuring that there is rational use of drugs, and they are active proponents of research in adducing evidence for improved therapeutics. And we would like to appreciate you for the partnership. Solidarity, unit of purpose is key, and this is a time when we all hold hands and ensure that we wage that common war against COVID-19. So we place on record our appreciation for your kind words and also for the solidarity with the government and the Zambian people. And this is as it should be. And congratulations for sorting out the rot at the head of the Pharmaceutical Society of Zambia. The situation in Zambia today shows that there is local transmission that started happening, but also shows that there is still importation of cases. This is the reason why all the provincial health directors, working with the provincial ministers, are under directive to ensure they follow precisely what His Excellency President Lungu said yesterday as he addressed provincial ministers in his address: strengthen leadership and oversight in all your districts, including border towns, to strengthen surveillance and limit importation of new cases. Strengthen surveillance in your communities so that you pick up new cases and isolate them and make sure they are managed. And ensure that we work together in a whole government approach to first of all address the public health emergency, but also minimize the disruptive effects on all the other areas of our economies and livelihoods. That's why it is important to emphasize the broad aspiration that President Lungu has declared, that he would want to ensure that Zambians do not suffer, they don't get hungry, we don't entrench poverty, we don't ground the economy to its knees, but ensure we strike that important balance with avoiding a catastrophe in the health of our people, because the catastrophe in the health of our people will actually ground that economy that we're trying to protect. That's why it is important that we summon the best of our conduct as citizens at personal level to ensure we adhere to the directives that were given out. We need to act now to ensure we avoid this. Let's continue paying tribute and supporting our health workers at the front line and their multi-sectoral partners as they battle COVID-19 at that battlefront. And your conduct will support the quick end to COVID-19 and the preservation of those frontliners that we are working together, that we're working on COVID-19. So let us ensure all stakeholders do not relax or become complacent as we cautiously reopen selected areas of our economy. The sage is on, and that's exactly what President Lungu means by saying we're still living with COVID, but we need to reset to a new normal and ensure that important balance. So our donors that have been working with us, the business world, our professional bodies, we thank you most sincerely for the unity of purpose and solidarity, key components of the fight against COVID-19. And my very last comment is in reference again to one important message in President Lungu's address to the nation, resilience in our health systems. Mothers still die from preventable maternal deaths, maternal conditions. Children still succumb to vaccine-preventable illnesses, to bad nutrition. Adults who are overfed, adults who overindulge and are physically inactive and smoke their lives away are still our concern. It is important to ensure that in ensuring resilience in our health systems and services, we do not neglect our focus on HIV, malaria, TB, child health, maternal health, non-communicable diseases, and other communicable diseases. Because COVID-19, yes, is an affront to Zambia, but speaks to one pillar of our health systems, public health security, yes, with the disruptive effects on everything else, but let us remain focused on the agenda that government under President Lungu has, health for all, and legacy goes to defeat HIV, AIDS, malaria, maternal deaths, child deaths, communicable diseases, and non-communicable diseases. So let us remain focused. Thank you very much and have a great day.